The subject given to me is close to my heart because I have been practicing it for more than 35 years now. Previously at the All India Institute and then at another hospital. Emphasizing what I'm going to talk is we breathe about 10,000 liters of air which enters our lung every day. And we require 420 liters of oxygen to be alive. That is why we breathe. The World Health Organization in 2012 estimated that 7 million people die as a result of exposure to polluted air. And I'm going to touch upon this. And 3 lakh people die of tuberculosis every year. And lung cancer is number one cause of death, not only in India, but all over the world. And COPD, what you call as bronchitis, is the third leading cause of death all over the world. So ultimately, what are the reasons and what are the solutions? I may apologize at the beginning. The solutions are known, but their implementation seems to be difficult for the human beings. So first I'll talk about the life expectancy of Indians. As the India became independent in 1951, the life expectancy at birth was 32 years only, and subsequently it increased in 1991 to 58, and now we have reached 70, and the latest figure of 2023 is 72 years. So that's amazing economic, social development, but we are far behind. Hong Kong has a life expectancy of 85 years, and then comes Macau and then Japan. And if I compare it with the whole of the world, the Australians and so many other countries, Switzerland and all, they are 80 plus. We are still at 70, only a little above Pakistan. What are the reasons for that? Why why our life expectancy? We are boasting to be a big economic power soon enough. Why our life expectancy is 70 years? It's a big gain from 35 years. But there has to be a reason for that. In the October 30th, the study came from Chicago in an international journal, which said the lifespan of Indians is reduced by average 5.3 years due to air pollution. Average. Now, if you add 72 plus 5.3, it becomes we are close to US. That the lifespan of Delhiites, where I live, is reduced by staggering 11.9 years. Another thing was that China took to air pollution on a war footing, and over a period of say 8 years' time, their life expectancy improved by 2.2 years. So there's an intervention which can improve, and I'll come to this topic. And if you talk about Kerala, it's doing very well. The life expectancy of females is 77 point, close to 80 years. Why the males are lagging behind in Kerala? You have to do some introspection. Miss Michelle is smiling. She is very happy. But we have to think what are the reasons for that? Is the smoking is the one, is the air pollution is another, or some alcohol abuse or whatever, you know. Is the lifestyle something is there a miss that there's such a difference between Kerala? You have to do some introspection about it. Now coming to my topic, that is lung, and this is from a paper which came out in one of the world's most prominent journal, that is called Lancet in 2019. It is a deaths per 100,000 population, and this is 2019. COPD is a bronchitis, which is a preventable disease where the smoking is the important cause. 58.7, infections is 30.9, and of course, the commonest is of course coronary heart disease. So my job is not to talk about, and of course, the tuberculosis. So I'll come to the lung health now. In general, what is lung health? So this is what India Gate is. What we before Diwali. This is what happens after Diwali. It gets blurred, and you must have heard flights getting cancelled, flights getting diverted, and so on and so forth in Delhi. There's such a smog in the morning that the visibility comes to zero. But that doesn't bother us. And during COVID time, when everything stopped, there was no air pollution. This became like any developed country, India today. How does it affect us? This is a healthy regular lung seen during the surgery. This is from Himachal Pradesh, and this is the black lung in a non-smoker person of Delhi. So this is what is happening to our lungs. And everybody in Delhi is a worried person today seeing this. And no amount of inhalers or antibiotics or any drug can change this lung to a pink lung. So, chronic respiratory disease were responsible for 10.9, that is 11% of deaths in India. And, and of the total disability adjusted life years due to chronic respiratory diseases, 32% were in our country. So that is the extent. So what are the diseases that we deal with, which are responsible for such a disability? And as my topic is not only the cause of death, but also the disability, that quality of life that we suffer. The burden of chronic respiratory diseases is airway diseases. We all know bronchitis. People keep coughing. Asthma, of course, 5 to 10% of the world population is asthma, lung cancer, tuberculosis, and COVID. Mr. Prakash specially asked me to touch upon COVID also because although we hope that it is a thing of past, but I'll discuss about it. Now, COPD is the third leading cause, as I said, causing 3.23 million deaths in 2019. And 90% of COVID deaths in those under 70 years of age occur in low and middle income countries, is the seventh leading cause of poor health worldwide, and 70% of COPD comes from because of smoking. When I was studying, anybody has COPD, I thought he must be a smoker to develop COPD. But now the recent data say that 50% of COPD in India is because of indoor and outdoor air pollution, which I'll come to it later. And as you would see, Jammu and Kashmir, which is heavily polluted because of their burning, and also the smoking is rampant, COPD is most common. Kerala is number two, and Chhattisgarh and Bihar. I have a personal knowledge and the data that Bihar people chew tobacco more often than they smoke. So therefore, their uh, COPD rates are low. Smoking, indoor air pollution, occupation, genetic factors are responsible. Now, asthma is becoming more common. Asthma is not directly related to the air pollution. To tell you and shock you that 29% of in countries like Switzerland, Australia, New Zealand has asthma incidence of 29%. Now, there are various reasons for that, but nobody should think that asthma doesn't kill. Asthma kills 250,000 deaths annually. It's not an uncommon disease. If you talk about Delhi, 1 in 3 children are suffering from asthma. And these people, the 50% of the asthmatics keep getting exacerbation, reporting to emergency. And these nebulizations and inhalers, which are somewhat rare when I was studying and doing my post graduation. In Delhi, almost every household has got a nebulization machine because there are children. they are having wheezing, and it's not a happy situation at all. Now, coming to the topic of air pollution and health, which I touched at the beginning, and this actually has been my research area, and WHO has recognized me, and I am currently member of the expert committee for global health, air pollution and health, and I represent along with my colleague Dr. Mukesh Sharma. We are the two person who attend meetings in Geneva and also put across our views. And India is now rated as the capital of air pollution, unfortunately. So, as I already referred to Chicago study, that our life expectancy goes down by 5.3 years and lifespan, and this has not come by chance. This is a study by Peters and from UK, long term study, that when you are exposed to the noxious things like smoking, your lung functions come down. When you stop the smoking, it's plateaus. So it's never too late to prevent exposure to air pollution or smoking or whatever. I'll come to it later. So, in Delhi is today the world's most polluted city. Now you have an advantage. Mumbai has an advantage. Kerala has an advantage of water, backwaters, quite a bit of greenery, and we sort of takes few things as fait accompli. That okay, our AQI is very good. But today morning when I checked at the Google, Kochi had a poor status of AQI of 108. So do not think. And this is when I was starting this work on air pollution as a research almost 30 years back. Everybody used to look at Delhi as the most polluted city. Now, as the lens was on Delhi. Now, as the satellites have come and we are monitoring pollution in every city and almost every town, we have realized that Delhi is not the only city. Of course, Delhi, because of the geographical situation, because of the lack of winds and all, the pollution accumulates here. But whole of the country, more than 95% of India does not satisfy the air quality standards of World Health Organization. So, in my thinking, no amount of air pollution is safe. So, this 108 of AQI in Kochi, and also I keep following Trivandrum and other cities also. What is the reason? As far as Delhi is concerned, the road dust is very important. The vehicles, road dust is as much as 38. So, if you have vehicles running on a dirty roads, which is very common all over the country, it adds to as much as 38%. Vehicles 20% and domestic fuels. Whatever you are burning in the house for cooking or whatever, and industrial sources will ultimately go to the atmosphere and cause pollution. So what are the adverse effects of atmospheric air pollution? They don't confine to lung, unfortunately. You must have heard about PM 2.5, you see every day. Now, PM 2.5 is the particles which enter our lower part of the lung and deposit there. It may be from the diesel, it may be from the industry, it may be from the coal. But how the lungs are affected? There's something called ultra fine particulate which are not measured. It's a research tool. The ultra fine particulate, they cross the lung and go into the bloodstream and go to the brain, go to the heart, go to the intestine, go to the kidney. So no part of body is unaffected. So there are cardiovascular, there's more heart attacks, there are more eye changes, there are skin changes, you get itching, there are neuropsychiatric. Even dementia is more common if the pollution is much more. And Long-term exposure lead to molecular and cell toxicity and leads to variety of cancers. So as you look for it, the air pollution is affecting us. And there was a study done in North Carolina, which was published recently, where they looked at reading capacity and mathematical capacity of children of 8 to 12 years of age. And they found out that their reading capacity and doing mathematics capacity goes down as the PM 2.5 increases. And they were not studying air pollution at what we are. They were studying air pollution as PM 2.5 of 10 to 15, and we are at 50 and 100. So there are so many other effects. So this only summarizes the respiratory effect. The immediate effects are discomfort such as irritation to the nose, throat, eyes, headache, dizziness, nausea, exacerbation of asthma, COPD, and respiratory infection, and ischemic heart disease, and of course, nerve damage, and so on and so forth. It was also exemplified during COVID when it was found out the mortality in Italy. North Italy was three times that of southern Italy, and it was attributable to the air pollution because northern Italy is a polluted part of the Italy. So air pollution causes inflammation in the airways, which becomes a bed for uh, reducing the reduced immunity of the lung, leading to severe disease. So, as the title was that how does lung health of India is affected? This is the effect of mortality and lifespan on air pollution. Majority of people will have no symptoms, subclinical effects, as I have been discussing. Some of them will have symptoms of cough, like decline in lung function and increase in requirement of medication, like inhalers. Few of them will have hospital visit. Some of those hospital visits will be emergency room visits and hospital admission, and some would die. So we worry about this deaths, but actually our life quality of life is affected here. Coming to the tsunami of COVID-19, and Mr. Prakash especially asked me to touch upon that. I hope it doesn't come back. We keep, by some chance, the first case of COVID was detected in Kerala, and also the JN1 new virus was also detected in Kerala. It is not only because of the international travel, it is also because the Kerala has a very good testing facility, very good medical facility, so they detect it. So I would give it as a credit. So there was COVID pandemic was a devastation. It was a tsunami. 767 million confirmed cases of COVID were there, and there were as many deaths with unprecedented catastrophe. Every day was some new lesson. And unfortunately, I don't think there's anybody who has his very near dear or a family member or a very dearest of the friend has died. As many as 1 in 1300 people in the world died during this devastation. And they were COVID warriors, of course, doctors, nurses, healthcare workers, paramedical staffs. The mortality was much more in them because they were more exposed till the time vaccination came, and mortality came down because they were the first one to be vaccinated. And lung was worst affected. Whosoever was admitted with COVID was carrying, my score was 8 by 25, others was 7 by 25, somebody on oxygen. And you are going on television frequently, advising people to wear mask and so on and so forth. But it didn't stop here. As the COVID finished, our OPD attendance was there. These people had fatigue, they had shortness of breath, some had joint pain, some had chest pain, They had they had continuous cough. They were unable to sleep even 2 years after COVID. There were rhinitis, there was red eyes, there was the sense of smell and taste was altered. There were headaches, there was sputum production, appetite was not there, and there was something called brain fog. So many people thought that they are unable to. They just they get lost. There's period of absence where their memory is not there. All these are attributed and to this, and 55% had three or more persistent symptoms. And this is not only attributed to COVID-19. The SARS and the MERS, that those were also coronavirus infections. After 3 years of the disease, when they phoned up, 40% said that we feel fatigue. So these are the long-term effects of COVID. Only time will tell how much time they remain there and how much time they go. So there are skin manifestation, there are cardiac, there are more heart attacks after COVID. There is more thrombosis. As I said, neurologic headaches are extremely common, and there is liver involvement, more diabetes and ketoacidosis. The bowel disturbances were extremely common, and we have seen it all in our practice and well reported in the literature. Finally, I've scared you enough, with my presentation. Now, how do you improve our lung function? What do you do about it? I will not go into the subject of air pollution because air pollution is, people say it's everybody's job, but my personal thinking is that it is the administration and the politicians. They have to make policies. 100 years back, the California had similar traffic snarls, similar air pollution as Delhi has. And 100 years down the line, the air pollution in California went down more than 10 times. Number of vehicles went up 10 times. This is because they had strict norms for fuel and strict norms for engines. If your engine is bad, you have to just junk it. You cannot use it on those roads. They are very strict about it. So you have to look at the sources. And if I talk about Delhi, the sources along with the uh, vehicles and fuel, there dust, there is unorganized construction, there are power plants which are run on coal. So I'm not going to go into this because I should finish on time. First and the foremost important thing in improving the lung health is the quitting smoking. Now, the risk of stroke is reduced in 5 to 15 years after you quit smoke. The risk of heart disease becomes equal to non-smoker. It takes 15 years for effect to go down. And risk of lung cancer become almost 50% 10 years. It never becomes zero. Heart rate and blood pressure will immediately come down in 20 minutes. Risk of coronary heart disease reduced to half in 1 year's time. And carbon monoxide and blood drop within 12 hours. So what I'm going to say is that if there's a difference in the life expectancy by about 9 years from smoker and non-smoker. It's never too late to quit smoking. And the benefits I have already. This is one single way of improving the lung function. Diet has role in general health, so it affects it improves the lung health also. But more than diet, the walking exercise, the walking, cycling, strength training, non-specific aerobic training, physical activity should be part of lifestyle and may be performed in groups or whatever. How does it help? The exercise. It improves the lung function. It reduces the risk of flare up. It's, it also leads to better weight management. Now, benefits of healthy diet. The Indian diet is atrocious. The high energy, dense food, red and processed food, added sugar, high salt intake, preservative, low antioxidants, high glycemic index. These are detrimental. Fruits, vegetable, whole grain, alcohol and wine in moderation. And nuts, coffee, fish. That's why the life expectancy in Kerala is high, probably. High antioxidants, low glycemic index, and unsaturated fats. Those are important. And of course, yoga. India is also a capital of yoga. This has been disseminated all over the world. It involves some breathing exercise also. There's a scientific evidence when the obese people who lost their weight, uh, their lung functions improve. So if you are overweight, try to reduce weight as much as you can. And it is a scientific part that the immunity improves, the TH1. This is little technical, so I would. So tips from the dangers of outdoor air pollution. So this is true for Delhi people. Probably Kerala, you don't have to worry about it. If people want to go outdoor, please consider wearing a mask. Not all masks are created equal. Now, in the COVID, we kept saying that use a simple mask, use a clothes, use a surgical mask, you will get some amount of protection. But if you want to be protected from air pollution, you have to use N95 or N90, KN95 mask. This will give you, although WHO doesn't agree to that. And if you can use a mask with a filter. Now, some people feel claustrophobic, but the scientific evidence says that oxygen doesn't drop when you wear a mask and do exercise. If you go to Delhi homes, except my house, everybody is keeping an air purifier. They put on the air purifier, they think that they have done a great thing for themselves, and their air is very clean. And in fact, that meter shows that AQI has improved. So, okay, it can be used, but in the WHO meeting when I was there a few years back, and I was saying, we were discussing that they have actually dumped it completely. There's no scientific evidence that it improves the health. However, I say that lack of evidence is not evidence to contrary. If your air pollution in your city is very bad, and if you are suffering from a chronic lung disease, then there is some wisdom in using air purifier, but the room has to be closed, the air conditioner has to be in the closed circuit, and air purifier should be on all the time. Not that you go in the room and then put on the air purifier. These are the few things. And it must have a HEPA filter in it so that its efficiency is guaranteed. Now, finally, does vaccination does improve the lung health? And vaccination came in a big vogue in COVID. It saved us from severe disease. It saved us from mortality. And I think it did, despite controversies going around. The Indian vaccines did tremendously well, and it protected us, and it saved lots of lives. So, does vaccination improve lung health? Influenza and pneumococcal. Influenza vaccine is given every year, and flu is there in Delhi today. Pneumonia vaccine also is important. All individuals above 60 or 65 years, and those with diabetes, hypertension, or lung disease, asthma, bronchitis, should get, even if they are less than 65 years, should get the influenza vaccine every year and pneumococcal vaccine every 5 years. So vaccination reduces seriousness of illness, as we have seen in COVID time. Finally, the depression and anxiety are common in COPD and in chronic lung disease. and they should be managed with whatever interventions are required to do. So, what is the take home message from my deliberations? We are, as I said, we are breathing 10,000 liters of air. So, it is important if you could breathe good air and not mixed with tobacco. Almighty has granted defense mechanism which protects us from disease. It is important not to abuse our lungs with smoking and air pollution to have a perfect lung health. And prompt diagnosis and treatment of ailment is of paramount importance. And healthy lifestyle compounded with vaccination will keep our lung healthy. So, with that, ladies and gentlemen, thank you for your kind attention. And it has been a pleasure talking to you, and I'll be very happy to indulge in discussion if I could be of some help to that. Thank you very much.